Yes, this is your boy Jacob. Now we are going to look at the 6 COVID-19 vaccines approved by WHO. Now the 6 COVID-19 vaccines are categorized into 3 according to their mode of actions. Now in number 1 we have the viral vector vaccines. Then number 2 we have the messenger RNA COVID-19 vaccines. Then number 3 category we have the inactivated COVID-19 vaccines. Now, the viral vector COVID-19 vaccine, we have the AstraZeneca vaccine and then Johnson & Johnson. Then in the messenger RNA vaccines, we have the Moderna and Pfizer vaccine. Then the inactivated COVID-19 vaccine, we have the Sinopharm and Sinovac vaccine. Both of those are made by Chinese companies. Now, which of these vaccines is best for you? As we come back, I'm going to explain to you each and everything you need to know about these vaccines. So we are going to look at the 6 COVID-19 vaccines approved by WHO. They are categorized in 3: the viral vector vaccines, the messenger RNA vaccines, and the inactivated COVID-19 vaccines. So in the viral vector vaccines, we have AstraZeneca, which is from Oxford, the UK. Then Johnson & Johnson, which is from an American company, Johnson & Johnson. So the viral vector vaccines use a modified version of a different virus, in brackets vector, to deliver important instructions to cells. So how does it work? What's its mode of action? The vector enters the body and uses the cells to produce harmless piece of virus known as the spike proteins. So the spike proteins will trigger the immune system to produce antibodies to fight COVID-19. So in brief, that's the mode of action of the viral vector vaccines. So what are the benefits of someone getting a viral vector vaccine? All vaccinated gain protection without ever having to risk serious consequences of getting sick with COVID-19. So basically, that's the major benefit of getting this type of vaccine. Now, number 2, let's look at the messenger RNA vaccines. In the messenger RNA vaccines, we have the Pfizer vaccine and Moderna. So basically, the Pfizer vaccine is made from Manhattan, New York City, while the Moderna is made from Cambridge and Massachusetts in the USA. So basically, those are names of companies of these vaccines. So in brief, the messenger vaccines teach our cells how to make the protein known as the spike proteins. These are formed on the surface of the COVID-19 virus, and once the spike proteins are made, they trigger immune system to make antibodies. So that's the difference. With the viral vector, they use a vector, but the messenger RNA teach our cells. You don't need a vector, but they teach our cells to produce the spike proteins, which cause the immune system to trigger the antibodies. So this is the difference in mode of action of the two. So how do you benefit from messenger RNA vaccines? All vaccinated gain protection without ever having serious consequences of getting sick with COVID-19. So the benefits are almost the same. So now let's look at the third category of these vaccines. So in the third category, we have the inactive vaccine against COVID-19. So in this category, we have Sinopharm and Sinovac. Both these vaccines are made from Chinese pharmaceutical companies. Sinopharm is made from a pharmaceutical company in China, and also Sinovac is made from a pharmaceutical company in China. So what's the mode of action of these two? So the mode of action is once the inactivated viruses get presented to the body immune system, they stimulate production of antibodies. So basically that's the mode of action of Sinopharm and Sinovac. So once the vaccine gets in your body, it stimulates the immune system to produce the antibodies. So it's almost the same like all the other regular vaccines. Its mode of action is the same. So when you look at the contraindications, the biggest contraindications of all these vaccines is no history of anaphylaxis to any component of a vaccine. Then when we come to precautions, all persons should be vaccinated in a healthcare setting. In case of allergic reactions, medical treatment is available. So that's the reason why all people who are to be vaccinated have to be in a health setting. So in case you get an allergic reaction, there will be medical treatment for you. And there has to be an observation of 15 minutes. Yes, 15 minutes before they can let you go. So those are the major precautions of all types of vaccines. So this is the short table to summarize the requirements of this vaccination. So the Pfizer vaccine is the brand name. So the age limit is 12 and above years for this type of vaccination. The shots, you need 2 shots for this type of vaccine, and it has to be an interval of 2 weeks between the shots. So if you get the first shot, you need to wait for 2 weeks before you get a second dose. For the Moderna, it is for 18 and above, and it also needs 2 shots and the duration of 4 weeks apart between the shots. Johnson & Johnson is for 18 and above. Anyone 18 and above can get it. Unlike all the COVID-19 vaccine, with Johnson you only need 1 shot. Yeah, period. One shot and it's enough. In case you need another shot, like many other researches where they are trying to produce one which has 2 shots, it will take 2 weeks. But currently you only need 1 shot and there is no interval between them. Then the AstraZeneca vaccine is also 18 and above. You need 2 shots and the duration of 4 to 12 weeks in between the shots. Then the Sinopharm is also for 18 and above, 2 shots with a duration of 3 to 4 weeks in between the shots. Then Sinovac is also for 18 and above, 2 doses, a duration of 2 to 3 weeks in between the shots. So in brief, this is a simple tutorial of the 6 COVID-19 vaccines which are approved by WHO.